ATLS, ACLS, and PALS, Advances in Emergency Life Support. Advanced Life Support Protocols in Transition. Recent developments in ATLS, ACLS, and PALS across the United States and Spain. A systematic review for the family medicine practitioner. Department of Family Medicine and Emergency Medical Education. Graduate Medical Research Division. James L. Mahan. April 19, 2026. 1 ATLS, ACLS, and PALS, Advances in Emergency Life Support. Abstract. Background, Advanced Trauma Life Support, ATLS, Advanced Cardiovascular Life Support, ACLS, and Pediatric Advanced Life Support, PALS, are cornerstone training programs for emergency care practitioners. Between 2024 and 2026, transformative updates to all three protocols have been implemented simultaneously in the United States and across Europe, including Spain, producing the most significant shift in resuscitation and trauma management in over a decade. Methods. This narrative systematic review analyzed peer-reviewed literature, official guideline, publications, and professional organization bulletins from January 2024 through April 2026. Sources included PubMed, the American Heart Association, AHA, Science Advisory. Publications, the American College of Surgeons, ACS, Committee on Trauma, the European Resuscitation Council, AC, 2025 Guidelines, and the International Liaison Committee on Resuscitation, ILCOR. A total of 46 primary and secondary sources were screened, with 16 selected for full text inclusion based on date, relevance, and evidentiary quality. Results. The ATLS 11th edition, 2025, introduced the XABCDE paradigm, elevating hemorrhage control above airway management. The AHA's 2025 ACLS guidelines formally discontinued routine calcium administration during cardiac arrest, expanded extracorporeal CPR, eCPR, indications, and standardized post-arrest temperature management. PALS 2025, Co. Developed with the American Academy of Pediatrics, AAP, introduced physiology-directed resuscitation targets including diastolic blood pressure thresholds and refined pediatric fluid resuscitation protocols. In Spain and the broader European context, the AC 2025 guidelines aligned closely with ILCOR recommendations, reporting improved traumatic cardiac arrest. 2 ATLS, ACLS, and PALS, Advances in Emergency Life Support. Survival data from Spain and expanding simulation-based training infrastructure across the Iberian Peninsula. Conclusions. Family medicine physicians represent a uniquely positioned professional cohort who must maintain current certification across all three domains. The 2025 to 2026 guideline era demands immediate curricular integration, ongoing simulation training, and a commitment to DEI inclusive practice within all resuscitation contexts. These updates carry significant implications for patient outcomes, professional credentialing, and institutional training standards in both the United States and Spain. Keywords: ATLS, ACLS, PALS, XABCDE, damage control resuscitation, extracorporeal CPR. European Resuscitation Council, Family Medicine, Pediatric Advanced Life Support, Resuscitation. Guidelines 2025. 3 ATLS, ACLS, and PALS, Advances in Emergency Life Support. Introduction. Emergency life support training is one of the most dynamic domains in clinical medicine. The triad of Advanced Trauma Life Support, ATLS, Advanced Cardiovascular Life Support, ACLS, and Pediatric Advanced Life Support, PALS, constitutes the operational backbone of Acute care across specialties. For family medicine practitioners, who routinely serve as the first or only physician available during emergencies, particularly in rural, underserved, and community-based settings, these protocols are not merely aspirational competencies. They are professional mandates. The period from 2024 to 2026 has proven to be one of the most prolific eras of guideline revision in the history of emergency medicine. The American College of Surgeons released ATLS 11 in 2025, representing a paradigm shift 4 decades in the making. Simultaneously, the American Heart Association, in coordination with the American Academy of Pediatrics and the International Liaison Committee on Resuscitation, ILCOR, released comprehensive 2025 updates to both ACLS and PALS guidelines, the most thorough revision since 2020. In Europe, the European Resuscitation Council published its own landmark 2025 guidelines, encompassing adult advanced life support, pediatric resuscitation, and first aid across its network of 31 national resuscitation councils, including Spain's national body. The convergence of these revisions offers a rare opportunity for comparative analysis across two major medical systems, the United States and Spain, that share a commitment to evidence-based, standardized emergency care, yet differ substantially in healthcare delivery infrastructure, training requirements, and integration of life support certification within primary care and family. For ATLS, ACLS, and PALS, advances in emergency life support medicine residency programs. This paper reviews the major methodological, pharmacological, algorithmic, and systemic changes across ATLS, ACLS, and PALS in 2024 to 2026, with particular attention to innovations of highest relevance to family medicine practice groups. We examine the treatment platforms, new technologies, simulation-based innovations, and intercontinental comparisons that define the current state of the art in emergency life support. Background and significance. The role of emergency life support in family medicine. Family medicine physicians occupy a unique position in the emergency care continuum. Unlike emergency medicine or surgery, family medicine encompasses the breadth of patient care across all age groups, from neonates to geriatric populations, and across a wide variety of clinical environments, including office-based practices, rural health clinics, urgent care facilities, and hospital-based outpatient departments. Certification requirements at institutions such as Indiana University Health explicitly mandate that family medicine physicians hold current ATLS certification upon initial appointment, alongside BLS, ACLS, or PALS, depending upon scope of practice and sedation privileges. IU Health, 2024. A 2024 observational cross-sectional study assessing BLS and ACLS proficiency among family medicine physicians found that while 60.5% had undergone BLS training within the preceding year, 37.2% had never attended an ACLS course, although Beatty et al., 2024. These findings underscore a critical training gap in a specialty that may be called upon to manage cardiac, traumatic, and pediatric emergencies with little forewarning. The implications are amplified in rural or low-resource settings where family physicians may serve as the de facto trauma and 5 ATLS, ACLS, and PALS, advances in emergency life support resuscitation team. Both the United States and Spain have recognized this training imperative through separate but complementary frameworks. In Spain, the National Sistema Nacional de Salud, SNS, and the Spanish Society of Family and Community Medicine, SEMFYC, have increasingly incorporated life support training into family medicine residency programs, aligning with the broader educational mandate released in 2025. Historical context of ATLS, ACLS, and PALS. Advanced trauma life support was first introduced by the American College of Surgeons in 1978 and subsequently launched internationally in 1980. Over the course of 10 editions, ATLS became the foundational global standard for trauma care, taught to over 1 million clinicians in more than 80 countries. American College of Surgeons, 2025. Its core philosophy: treat the greatest threat to life first, has remained constant, even as the specific protocols have evolved substantially. ACLS, developed under AHA governance, has been similarly influential since the 1970s. Its periodic 5-year update cycles have incorporated each generation's advances in cardiac pharmacology, defibrillation technology, and resuscitation science. PALS, likewise maintained by the AHA in partnership with the AAP since the 2025 cycle, has provided pediatric-specific protocols for cardiorespiratory arrest and critical illness since the 1980s. What distinguishes the 2024 to 2026 period from prior update cycles is the simultaneity and scope of these revisions. For the first time, ATLS, ACLS, and PALS guidelines were all significantly overhauled within the same 2-year window, catalyzed in part by a decade of emerging evidence from civilian and military trauma registries, randomized controlled trials in cardiac 6 ATLS, ACLS, and PALS, advances in emergency life support, resuscitation, and expanded pediatric outcome data from pediatric intensive care units globally. ATLS 11th edition, 2025. The ZABD revolution. Paradigm shift, from ABCDE to XABCDE. The most consequential change in ATLS 11, released in 2025, is the formal revision of the foundational triage algorithm from the traditional ABCDE sequence: airway, breathing, circulation, disability, exposure, to XABCDE, where the lowercase x represents exsanguinating hemorrhage control. Journal feed, 2026, Elsevier, 2026. This shift formalizes decades of evolving evidence demonstrating that uncontrolled hemorrhage, not airway failure, is the leading cause of preventable trauma death. The precedence of hemorrhage control is now operationalized through immediate deployment of tourniquets, wound packing, junctional hemostatic agents, and pelvic binders prior to airway assessment in patients with visible exsanguinating external hemorrhage. This protocol mirrors practices refined through military conflict medicine, particularly insights derived from operations in Afghanistan and Iraq that demonstrated tourniquet use significantly reduces mortality when applied within the first minutes of injury. Elsevier, 2026. The ACS notes that more than 200 clinical and educational experts from over 20 countries contributed to the reimagining of ATLS 11, ensuring its applicability across diverse practice environments, from high-resource level trauma centers in New York and Madrid to austere environments such as rural emergency departments. American College of Surgeons, 2025. This Flex Workgroup model is itself an innovation, a deliberate effort to make ATLS not only evidence-based but contextually flexible and globally scalable. 7 ATLS, ACLS, and PALS, advances in emergency life support. Damage control resuscitation, formalized and expanded. The 11th edition formally integrates damage control resuscitation, DCR, as a core ATLS principle. DCR involves a constellation of strategies: permissive hypotension, tolerating systolic blood pressure of approximately 80 to 90 mmHg until surgical hemorrhage control, early administration of tranexamic acid, restricted use of crystalloid fluids, and balanced resuscitation. Using whole blood or component therapy in a 1:1:1 ratio of packed red blood cells, fresh frozen plasma, and platelets, Elsevier, 2026. The scientific rationale for DCR is robust. Crystalloid resuscitation, long the default approach in trauma, has been associated with coagulopathy, hypothermia, and abdominal compartment syndrome, a triad known collectively as the lethal triad of trauma. The ATLS 11 curriculum directly addresses this by discouraging large volume crystalloid infusion and endorsing whole blood resuscitation as preferable when available, particularly in patients presenting with hemorrhagic shock, Elsevier, 2026. For family medicine physicians practicing in settings where blood products may be limited, ATLS 11 provides modified protocols that emphasize early tourniquet application, wound packing with hemostatic gauze, and rapid transfer to a definitive care facility, positioning the family practitioner as a critical link in the trauma chain of survival. Neurological trauma, spine management, and team dynamics. ATLS 11 also updates management of traumatic brain injury, TBI, recommending an early neuroprotective focus with judicious use of imaging, selective, rather than universal, spinal restriction protocols, and patient-specific care pathways. The previous standard of universal cervical collar application in all trauma patients has been revised toward selective spinal motion. 8 ATLS, ACLS, and PALS, advances in emergency life support restriction, guided by validated clinical decision tools, Elsevier, 2026. A distinctive pedagogical innovation in ATLS 11 is the explicit incorporation of team dynamics, communication frameworks, and guidance for delivering serious news to families of trauma patients. These soft skill competencies previously absent from ATLS curricula recognize that trauma care is a team-based endeavor, and that effective leadership and communication are as critical to outcomes as technical skill. This reflects a broader trend in medical education toward integrating human factors and closed-loop communication into high-stakes procedural training. American College of Surgeons, 2025. ATLS in the Spanish context. Spain has long been an active participant in the ATLS program. More than half of all global ATLS activity is conducted outside the United States and Canada, and Spain through its hospital system and university-affiliated surgical training programs has been an active adopter of each ATLS edition. The introduction of ATLS 11 has been accompanied in Spain by integration with the National Trauma Registry System and Simulation Center infrastructure at institutions such as Hospital Universitario 12 de Octubre in Madrid and Hospital Clinic in Barcelona. Spanish trauma epidemiology provides an important contextual backdrop. The X 2025 epidemiology report noted that patients with traumatic cardiac arrest in Spain achieved good neurological status at discharge at a rate of 6.6%, notably higher than the 2% reported in Germany during the same reporting period, suggesting that regional emergency response infrastructure and training culture meaningfully impact outcomes. Resuscitation Journal, 2025. This outcome data bolsters the case for ATLS 11 adoption and for continued investment in 9 ATLS, ACLS, and PALS, advances in emergency life support trauma care training across the Iberian Peninsula. ACLS 2025, Algorithmic Precision and Evidence-Based Pharmacology. Landmark Guideline Release and Implementation Timeline. The American Heart Association released its comprehensive 2025 guidelines for cardiopulmonary resuscitation and emergency cardiovascular care on October 22, 2025, at the ILCOR meeting in Rotterdam, Netherlands. A simultaneous global launch coordinated with the European Resuscitation Council, ERTS, 2025, AAP, 2025. The updated ACLS provider and instructor manuals underwent further revision as of February 6, 2026, with all AHA training centers mandated to adopt new course materials by March 1, 2026, American Heart Association, 2026. The 2025 guidelines are the product of structured evidence reviews conducted by the ALS Writing Group, incorporating systematic reviews, scoping reviews, and annual focused evidence updates conducted by ILCOR and its affiliates. Of the 760 total recommendations across adult, pediatric, and neonatal life support domains, only 1.4% achieved Level A evidence status A. Sobering reminder of the inherent ethical and logistical challenges in conducting randomized controlled trials within cardiac arrest populations. AHA, 2025, Project Heartbeat, 2026. Discontinuation of routine calcium and vasopressin. Among the most clinically significant pharmacological changes in ACLS 2025 is the formal discontinuation of routine calcium administration during cardiac arrest. Prior practice in many institutions included calcium as an adjunct during resuscitation. The 2025 guidelines make clear that calcium is no longer recommended unless specific clinical indications exist specifically. 10 ATLS, ACLS, and PALS, advances in emergency life support. Hyperkalemia, hypocalcemia, or calcium channel blocker toxicity. This change directly affects crash cart protocols, provider education, and clinical decision-making across emergency departments and intensive care units in both the United States and Europe. ACLS Academy. 2025, Dr. Oracle, 2025. Vasopressin has been similarly retired. Multiple systematic reviews and meta-analyses consistently failed to demonstrate survival benefit or improved neurological outcomes when vasopressin, alone or in combination with epinephrine, was compared to epinephrine alone. The 2025 guidelines eliminate vasopressin from cardiac arrest algorithms entirely, establishing epinephrine at 1 mg 4/IO every 3 to 5 minutes as the sole recommended vasopressor. For non-shockable rhythms such as asystole and pulseless electrical activity, epinephrine should be administered as early as possible after cardiac arrest confirmation. Project Heartbeat, 2026. Dr. Oracle, 2025. Extracorporeal CPR, ECPR, expansion. One of the most therapeutically significant expansions in ACLS 2025 is the upgraded recommendation for extracorporeal CPR, ECPR, in select patients experiencing cardiac arrest refractory to standard resuscitation. ECPR, which involves placing the patient on veno-arterial extracorporeal membrane oxygenation, VAECMO, during active resuscitation, was previously classified as a Class 2B intervention. In 2025, it has been elevated to Class 2A, reasonable to perform for appropriately selected patients within institutions that have trained teams and rapid deployment capability. Dr. Oracle, 2025, AHA, 2025. The implications for family medicine training are primarily organizational. Practitioners must be equipped to recognize candidates for ECPR early, initiate conventional ACLS without delay, and 11 ATLS, ACLS, and PALS, advances in emergency life support. Facilitate rapid transfer to ECPR-capable centers when appropriate. Family physicians in community hospitals that lack ECPR capability require specific protocols for early identification and seamless transfer, skills that the 2025 ACLS curriculum now addresses more directly than prior editions. Post-cardiac arrest care and temperature management. The 2025 ACLS guidelines standardize post-arrest targeted temperature management, TTM. Across all patients who do not follow commands after return of spontaneous circulation, ROSC. Spontaneously hypothermic post-arrest patients should not be actively revarmed faster than 0.5 degrees Celsius per hour. This represents a harmonization of previously variable institutional protocols and reflects substantial evidence from large multi-center trials demonstrating that fever prevention, if not active cooling, is associated with improved neurological outcomes in the post-arrest period. Dr. Oracle, 2025, AHA, 2025. The guidelines also address seizure management in post-arrest patients, indicating that a therapeutic trial of a non-sedating anti-seizure medication may be reasonable for adult cardiac arrest survivors with EEG patterns on the ictal-interictal continuum. This recommendation reflects the growing recognition that subclinical seizure activity following cardiac arrest is both common and independently associated with poor neurological outcomes. Dr. Oracle, 2025. Diversity, Equity, and Inclusion in ACLS. For the first time in ACLS guideline history, the 2025 document formally incorporates diversity, equity, and inclusion, DEI, considerations. The guidelines acknowledge a systemic underrepresentation of diverse populations in cardiac arrest research and call for improved methodologies to include participants from historically marginalized communities. This reflects 12 ATLS, ACLS, and PALS, advances in emergency life support, broader trends in medical evidence generation, and is particularly relevant in the context of documented racial disparities in bystander CPR rates, AED availability, and post-arrest survival outcomes across communities in both the United States and Spain. AHA, 2025, Fulton and Nordquist, 2026. Alignment and Spanish implementation. The European Resuscitation Council's 2025 Adult Advanced Life Support Guidelines, published simultaneously with the AHA update in October 2025, are directly based on ILCOR-COSTR Consensus on Science with Treatment Recommendations documents. These guidelines address the full spectrum of cardiac arrest care, including defibrillation strategy, advanced airway management, pharmacotherapy, and post-resuscitation care, with targeted recommendations for out-of-hospital and in-hospital settings across the ICS 31 member nations. Resuscitation Journal, 2025. Spain, as a member of the ICS network through its National Resuscitation Council, is subject to these guidelines, creating a system in which Spanish emergency physicians and family practitioners must navigate both domestic ICS-aligned protocols and, where applicable, specific institutional ACLS certification requirements that may align more closely with AHA standards. Simulation centers at Spanish universities and hospitals have increasingly incorporated blended learning platforms and scenario-based team training consistent with the ICS 2025 education for resuscitation guidelines, which provide detailed evidence-based frameworks for the design, delivery, and assessment of resuscitation education. Resuscitation Journal, 2025a. PALS 2025, Physiology-Directed Pediatric Resuscitation. Joint AHA-AAP Development and Scope. 13 ATLS, ACLS, and PALS, Advances in Emergency Life Support. The 2025 Pediatric Advanced Life Support Guidelines represent a landmark achievement in pediatric emergency medicine, the first co-development of PALS guidelines through a formally equal partnership between the American Heart Association and the American Academy of Pediatrics. Prior guideline editions were primarily AHA products, with AAP consultation. The 2025 edition reflects a structural integration of both organizations' scientific and clinical Expertise through a unified writing group co-chaired by experts from each body, AAP, 2025. Pediatrics, 2026. The guidelines cover resuscitation of infants and children up to 18 years of age, excluding newborns, who are addressed in a companion neonatal resuscitation document. They supersede all prior AHA-PALS recommendations from 2020 and incorporate evidence from systematic reviews, scoping reviews, and focused evidence updates conducted by the ILCOR Pediatric Life Support Task Force between 2020 and 2024, AHA/AAP, 2025. Physiology-directed resuscitation, a new standard. The most conceptually significant advancement in PALS 2025 is the explicit elevation of physiology-directed resuscitation over purely algorithmic approaches. For the first time, the guidelines incorporate specific diastolic blood pressure, DBP, threshold targets during pediatric CPR as objective measures of coronary perfusion quality, DBP greater than or equal to 25 mmHg in infants and greater than or equal to 30 mmHg in older children when invasive arterial monitoring is available, Littman, 2025. These thresholds are based on mounting clinical and experimental evidence associating adequate DBP with higher rates of return of spontaneous circulation, ROSC, and improved survival. For family medicine practitioners working in acute care environments, the practical implication. 14 ATLS, ACLS, and PALS, advances in emergency life support, is the adoption of continuous arterial blood pressure monitoring and end-tidal CO2 measurement as standard adjuncts during pediatric resuscitation modalities previously considered optional or specialty-dependent but now formalized as quality indicators. PALS 2025 Guidelines. Updated fluid resuscitation and shock management. The 2025 PALS guidelines significantly revise pediatric fluid resuscitation protocols. In trauma-related hypotensive hemorrhagic shock, blood products are now preferred over crystalloid volume resuscitation, mirroring the adult ATLS approach. For children in septic shock or non-hemorrhagic states, intravenous fluid aliquots of 10 to 20 ml/kg are now recommended, departing from the previous standard 20 ml/kg bolus approach. This revision reflects evidence that aggressive crystalloid resuscitation in children, as in adults, may worsen outcomes through dilutional coagulopathy and pulmonary edema. PALS Guidelines Summary, 2026. Children with septic shock who fail to respond to fluid administration are now explicitly recommended to receive vasopressors early, alongside consideration of stress dose corticosteroids in refractory cases. These recommendations align pediatric septic shock management more closely with adult surviving sepsis campaign guidelines, enabling family medicine providers to apply more consistent principles across the age spectrum. Airway management and ventilation updates. The 2025 PALS guidelines update rescue breathing rates for pediatric patients in respiratory distress or arrest. The new recommendation is 1 breath every 2 to 3 seconds, representing an increase from prior recommendations of 1 breath every 6 seconds for intubated pediatric patients. PALS Guidelines Summary, 2026. This change reflects evidence that more frequent ventilation during pediatric cardiac arrest, particularly in respiratory etiology arrests, may improve. 15 ATLS, ACLS, and PALS, advances in emergency life support outcomes given the primacy of respiratory failure as the precipitating event in most pediatric arrests. Bystander CPR guidelines for children have also been refined. Bystanders unfamiliar with PALS rescue breaths are now clearly instructed to provide chest compressions alone, reducing barriers to bystander intervention and increasing the likelihood of response in pediatric out-of-hospital Cardiac arrest. EMS dispatchers are explicitly directed to offer dispatch-assisted CPR. Instructions for Pediatric Sudden Cardiac Arrest, PALS Algorithms, 2026. eCPR in Pediatric Arrest and Post-Resuscitation Neurological Care. Extracorporeal CPR is now considered a reasonable intervention for pediatric in-hospital cardiac arrest, particularly in children with underlying cardiac diagnoses or when conventional CPR fails. To achieve ROSC, the guidelines recommend transfer to an intensive care unit capable of extracorporeal life support as early as possible in children with cardiomyopathy or structural heart disease who experience cardiac arrest. PALS Guidelines Summary, 2026. Post-resuscitation neurological care has been expanded in PALS 2025 to include continuous electroencephalography, CEEG, monitoring with detection and treatment of nonconvulsive status epilepticus, NCSE. The ROSC and post-cardiac care pulse oximetry target range is now standardized to 92 to 98%, avoiding both hypoxia and hyperoxia in the post-arrest period. PALS Guidelines Summary, 2026. Neonatal Resuscitation, a Companion Innovation. A companion piece to the PALS 2025 guidelines introduces the newborn chain of care, a novel conceptual framework that extends the context of neonatal resuscitation from the delivery. 16 ATLS, ACLS, and PALS, advances in emergency life support. Room through postnatal recovery and follow-up. This framework represents the first time neonatal resuscitation guidelines have been framed within a longitudinal care continuum, explicitly linking prenatal care, delivery room interventions, and postnatal stabilization as a unified care pathway. AAP, 2025. Updated protocols for umbilical cord management and oxygen titration in the neonatal period reflect evolving evidence on delayed cord clamping and targeted oxygen therapy, both of which have significant implications for family physicians who provide obstetric and newborn care in community and rural hospital settings. Comparative analysis, United States and Spain. Structural differences in life support training. The most fundamental structural difference between United States and Spanish life support training frameworks is the regulatory and organizational context. In the United States, ACLS and PALS certification through the AHA is a near universal requirement for physicians in acute care settings, with explicit institutional mandates enforced through medical staff credentialing. ATLS, administered by the ACS Committee on Trauma, carries equivalent institutional weight for surgical and emergency medicine practitioners, with family medicine physicians frequently required to hold ATLS certification as a condition of hospital privileges and sedation authority. IU Health, 2024. In Spain, the IC serves as the primary standardizing body for adult and pediatric advanced life support, while ATLS is administered through ACS-affiliated programs that operate within the Spanish trauma care infrastructure. The IC's 2025 Executive Summary describes a network of 31 national resuscitation councils, with Spain's council actively participating in the development. 17 ATLS, ACLS, and PALS, advances in emergency life support and dissemination of guideline updates, Resuscitation Journal, 2025b. Spanish Family Medicine. Residents, aligned under the SEM-FYC training framework, are required to complete life support training during their 4-year residency program, typically including BLS and at minimum ACLS equivalent training. Simulation-based education, convergent innovation. Both the United States and Spain have invested heavily in simulation-based medical education. SBME, as the preferred pedagogical platform for ATLS, ACLS, and PALS training. High fidelity mannequin-based simulators, immersive team training scenarios, and debriefing. Frameworks are now central to all three certification programs on both sides of the Atlantic. The ACLS 2025 Education for Resuscitation Guidelines provide detailed, evidence-based recommendations for the design and assessment of resuscitation education, including guidance on simulation duration, feedback modalities, and assessment rubrics. Resuscitation Journal 2025A. The AHA's own Heart Code and Resuscitation Quality Improvement (RQI) platforms have been updated to incorporate 2025 guideline science, offering continuous competency tracking and interval simulation-based refreshers rather than episodic 2-year recertification cycles. This shift toward continuous competency assessment is mirrored in Spanish programs that have adopted the exblended learning approach, combining online pre-course modules with in-person skills training and team-based megacode scenarios. ERTS 2025. Technology Integration and Digital Innovation. A shared feature of the 2025 updates across both geographies is the acceleration of technology integration into resuscitation training and care delivery. The ACS My ATLS mobile application, 18 ATLS, ACLS, and PALS, Advances in Emergency Life Support, provides real-time access to ATLS 11 algorithms, calculators, videos, and skill station checklists representing a significant advance in point-of-care decision support. ACS 2025. In Spain, parallel digital tools have been developed through University Hospital Innovation Programs and the Spanish Society of Emergency Medicine, SEAMS, to support a guideline integration at the point of care. Wearable resuscitation quality monitoring devices, real-time capnography during CPR, and automated CPR devices such as the Lucas and AutoPulse systems are increasingly incorporated into both American and Spanish emergency response systems, providing objective data on compression quality and enabling more precise titration of resuscitation efforts to physiological endpoints now formalized in ACLS and PALS 2025 guidelines. Epidemiological alignment and outcome data. Both countries share a commitment to rigorous cardiac arrest registry infrastructure. In the United States, the AHA's Get With the Guidelines Resuscitation Registry provides a national platform for outcome tracking and quality improvement in in-hospital cardiac arrest. The ACLS template, updated in 2024, provides a parallel standardized framework for out-of-hospital cardiac arrest reporting across Europe, enabling meaningful cross-national comparisons. Resuscitation Journal 2025 c. Approximately 350,000 Americans experience out-of-hospital cardiac arrest annually, with approximately 10.4% surviving to hospital discharge and only 8.2% achieving good neurological and functional outcomes. Fulton and Nordquist, 2026. Spanish data, while organized under a different national reporting framework, reflects comparably challenging survival statistics for out-of-hospital events but demonstrates notably improved outcomes in specific subgroups. 19 ATLS, ACLS, and PALS, Advances in Emergency Life Support. Particularly traumatic cardiac arrest, where Spanish centers have achieved 6.6% good neurological survival rates. Resuscitation Journal, 2025 c. Methodology of Review and Treatment Platforms. Literature Search Strategy. This narrative systematic review was conducted using a structured multi-database search approach. PubMed/Medline was queried using mesh terms and keyword combinations, including Advanced Trauma Life Support, ATLS 11, XABCDE, Damage Control, Resuscitation, Advanced Cardiovascular Life Support 2025, ACLS Guidelines Update. Pediatric Advanced Life Support 2025, Extracorporeal CPR, European Resuscitation Council 2025, and Spain Cardiac Arrest Outcomes. The AHA Science News Portal, ACS-ATLS. Program website, EC Guidelines 2025 portal, and ILCOR website were searched for primary guideline documents, executive summaries, and course update materials. The search period was restricted to January 2024 through April 2026. Inclusion criteria required that sources be published or released within the search window. Directly address one or more of the three life support protocols under review, ATLS, ACLS, PALS, and present either primary data, systematic review findings, guideline recommendations, or authoritative institutional policy. Sources were excluded if they were opinion pieces without evidentiary basis, published prior to 2024 without formal guideline status, or derived from non-peer-reviewed lay publications. From 46 initially identified sources, 16 were selected for primary inclusion. Additional sources were used for contextual background, current treatment platforms and algorithmic innovations. 20 ATLS, ACLS, and PALS, advances in emergency life support. The treatment platforms underpinning 2025-era emergency life support reflect a convergence of four major streams. 1. Evidence-based algorithmic refinement, such as the XABCDE sequence in ATLS and DBP-targeted CPR in PALS. 2. Pharmacological rationalization, exemplified by the elimination of routine calcium and vasopressin from ACLS. 3. Technology integration, including eCPR, continuous capnography, and real-time CPR feedback devices. And 4. Educational platform modernization, encompassing blended learning, continuous competency assessment, and simulation-based megacode training. For family medicine practitioners, the most actionable treatment platform advances include recognition of hemorrhage as the primary trauma priority under XABCDE, permissive hypotension in trauma prior to surgical hemorrhage control, epinephrine as sole vasopressor in cardiac arrest, eCPR pathway activation for refractory arrest patients, DBP-targeted pediatric CPR, and blood product preference over crystalloid in pediatric traumatic shock. Each of these advances requires deliberate integration into clinical workflows, standing orders, and departmental protocols. Implications for family medicine practice groups. Certification and credentialing requirements. Family medicine physicians must navigate a complex credentialing landscape in which ATLS, ACLS, and PALS certifications may each be required depending upon scope of practice, setting, and institutional policy. The transition to 2025 ERA guidelines carries immediate certification implications. Providers currently certified under 2020 ACLS and PALS guidelines, or under ATLS 10, must complete updated training to remain compliant with current standards. The AHA mandated that all training centers adopt 2025 materials by March 1, 2026, and 21 ATLS, ACLS, and PALS, advances in emergency life support. Instructor Essentials courses reflecting the new science were released in early 2026, AHA, 2026. ERTS, 2025. Family medicine residency programs should incorporate ATLS 11, ACLS 2025, and PALS 2025 into their formal curriculum in a deliberate and structured manner. Simulation centers at teaching hospitals provide an ideal venue for integrated training that exposes residents to all three protocols in a coordinated team-based environment, reflecting the interprofessional collaboration that characterizes real-world emergency response. Recommendations for practice group implementation. Practice groups serving diverse patient populations including pediatric, geriatric, obstetric, and trauma-vulnerable communities should adopt the following implementation framework based on the 2025 to 2026 guideline landscape. First, conduct a certification audit to identify which providers hold current certifications under 2025 guidelines and prioritize recertification through accredited programs reflecting updated AHA and ACS standards. Second, update crash cart protocols and code team standing orders to reflect the discontinuation of routine calcium and vasopressin, appropriate epinephrine sequencing, and post-arrest temperature management. Targets. Third, develop eCPR transfer protocols in collaboration with regional trauma and cardiac centers, ensuring that providers can rapidly identify eCPR candidates and initiate transfer without delay. Fourth, integrate ATLS 11 hemorrhage control principles including tourniquet training, wound packing competency, and pelvic binder application into office emergency preparedness plans, particularly for practices operating in settings where trauma may occur without immediate EMS support. Fifth, implement continuous quality improvement through simulation-based annual refreshers and real-time performance feedback, aligning with 22 ATLS, ACLS, and PALS, advances in emergency life support. Both AHA RQI principles and IC educational standards. Cultural and DEI considerations. The formal incorporation of DEI into ACLS 2025 guidelines has direct implications for family medicine, which as a specialty has historically championed health equity and culturally competent care. Family medicine practice groups should audit their patient populations for disparities in access to AED-equipped facilities, bystander CPR training, and post-arrest outcomes. In Spanish communities with large immigrant populations, language and cultural barriers to CPR bystander response represent specific areas for targeted community education. Consistent with IC initiatives that have included rapid BLS training in fan zones and public gathering spaces during major European events, Resuscitation Journal, 2025a. In the United States, the well-documented racial disparity in bystander CPR and AED use with Black patients significantly less likely to receive bystander CPR than white patients requires specific attention from family medicine groups practicing in urban and suburban environments. Integrating community CPR training into family medicine wellness visits and patient education programs is a low-cost, high-yield strategy for addressing this disparity at the practice level. Conclusion. The 2024 to 2026 period has produced the most sweeping and simultaneous revision of emergency life support protocols in the modern era of medicine. The transition from ABCDE to XABCDE in ATLS 11, the pharmacological streamlining of ACLS 2025, and the physiology-directed innovations in PALS 2025 each represent meaningful, evidence-based advances that carry direct implications for patient outcomes across clinical settings. For family medicine practitioners in the United States and Spain alike, these updates are not optional updates to background 23 ATLS, ACLS, and PALS, advances in emergency life support knowledge. They are operational imperatives that must be integrated into certification pathways, clinical protocols, and interprofessional training programs. The ACLS 2025 guidelines represent a parallel revolution in European resuscitation science, one that aligns closely with ILCOR recommendations while addressing the specific epidemiological context of European healthcare systems, including Spain's notably strong traumatic cardiac arrest outcomes data. The convergence of AHA and IC updates creates an unprecedented opportunity for transatlantic learning and protocol harmonization. Family medicine as a specialty is uniquely positioned to serve as the first and most consistent point of emergency intervention across the most diverse patient population in medicine. Meeting. This responsibility requires sustained commitment to the highest current standards in life support training standards that, as of 2026, are more evidence-based, more inclusive, and more technologically sophisticated than at any prior point in their history. Future research should prioritize higher quality randomized controlled trials in resuscitation science, expanded representation of diverse populations in cardiac arrest studies, and longitudinal outcome data from Spain and other European nations using the ACLS registry framework. For family medicine education, prospective studies examining the impact of integrated ATLS/ACLS/PALS simulation curricula on clinical performance and patient outcomes are urgently needed. 24 ATLS, ACLS, and PALS, Advances in Emergency Life Support. References. Although Beatty, R., Aldhahi, R., Although Beatty, M., Al-Salim, L.S., Al-Khaldi, H., Al-Mutari, N., and Ahmed, I., 2024. Evaluating the Effectiveness of Basic Life Support, BLS, and Advanced Cardiovascular Life Support, ACLS, Training for Family Medicine Residents in Saudi Arabia. Curious, 16, 11, E73637. https://doi.org/10.7759/curus.73637. American College of Surgeons. 2025, Advanced Trauma Life Support, ATLS Registered 11 Program. Overview and Course Updates. American College of Surgeons Committee on Trauma. https://www.facs.org/quality-program/trauma/education/advanced-trauma-life- support/ATLS 11/. American Heart Association. 2025, Part 9, Adult Advanced Life Support, 2025 American Heart Association Guidelines for Cardiopulmonary Resuscitation and Emergency Cardiovascular Care. Circulation, 152, Supple 2. https://doi.org/10.161/cir.0000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000000 Advanced Cardiac Life Support, ACLS. In StatPearls. Internet. StatPearls Publishing. https://pubmed.ncbi.nlm.nih.gov/40198051. Grieve, R. Bossert, L. Arntz, H.R. Bierent, D. Bingham, R. Bossert, L.L., and European Resuscitation Council Writing Group. 2025, European Resuscitation Council Guidelines. 2025 Executive Summary. Resuscitation, 201, 110,306. https://doi.org/10.1016/j.resuscitation.2025.110306. Indiana University Health. 2024, Life Support Certification Requirements, Facility/Group CPR. Requirements Table Policy Document. IU Health. https://cdn.iuhealth.org/resources/cpr-. Requirements Table.pdf. Journal Feed. 2026, March 17. New ATLS Update, The X Factor in Trauma Highlights from ATLS 11. Journal Feed. https://journalfeed.org/article-a-day/2026/new-ATLS-update-what- You need to know/ Joiner, B.L., Dewan, M., Baver, A., Decan, A., DiMaria, K., Donofrio Odman, J., Foss, G., Haskell, S., Magaub, M., Meckler, G., Request, J., Skexnader, S. M., Smith, M. O., Werho, D., and Raymond, T. T., 2026. Part 6, Pediatric Basic Life Support, 2025. American Heart Association and American Academy of Pediatrics Guidelines for Cardiopulmonary Resuscitation and Emergency Cardiovascular Care. Pediatrics, 157, 1. E2025074350. https://doi.org/10.1542/peds.2025-074350. Littman, R.S., 2025, November 24. 2025 American Heart Association Guidelines for Advanced Pediatric Cardiopulmonary Resuscitation and Emergency Cardiovascular Care Part 3. Substack post. https://ronlittman.substack.com/p/2025-American-Heart-Association- 26 ATLS, ACLS, and PALS, Advances in Emergency Life Support. Guidelines A2A. Project Heartbeat. 2026, January 21. 2025 AHA Guidelines, BLS, ACLS and PALS changes. Project Heartbeat. https://project-heartbeat.com/2025-AHA-guidelines-BLS-ACLS-PALS- Changes Project Heartbeat/ Resuscitation Journal. 2025a, European Resuscitation Council Guidelines 2025 Education. For resuscitation. Resuscitation, 201, 110,316. https://doi.org/10.1016/j.resuscitation.2025.110316. Resuscitation Journal. 2025b, European Resuscitation Council Guidelines 2025 Adult. Advanced Life Support. Resuscitation, 201, 110,281. https://doi.org/10.1016/j.resuscitation.2025.110.281 Resuscitation Journal 2025 C. European Resuscitation Council Guidelines 2025 Epidemiology in Resuscitation Resuscitation, 201, 110,245 https://doi.org/10.1016/j.resuscitation.2025.110.245 Sharma, D. 2026, February 3. Advanced Trauma Life Support 2025, a brief review of updates. Injury, International Journal of the Care of the Injured, 57, 4, 113,079. https://doi.org/10.1016/j.injury.2026.113079. 27.